Our studio guest, Dr. Jonathan Tripp, joining us on Wednesday mornings between 8:30 and 9 o'clock. And we're going to be talking a little bit about some of the pluses today of Tripp Family Medicine and actually having that, what you might call direct care with the people who actually run the facility. Although he's not here to denigrate the big guys, that is, the large corporate medical providers. He's just here to talk a little bit about some of the differences and what you might see. First of all, at 8:34:71, you're listening, of course, to Top Story with Bill Colley as well on News Radio 1310 KLIX and newsradio1310.com. And welcome back.
Thank you.
We were just talking off air about some of these things, and there are some advantages even for you when you're dealing with some of the larger providers because you'll see a patient sometimes who used to be at a larger provider.
Correct. And so if somebody comes into our office and says, "Can you get a hold of my medical information?" The answer is yes. And I can turn to one source in our area, that's St. Luke's. If the patient has been to multiple specialists or had labs or radiology things done, I can turn to one medical records office and say, I need these particular records so that I know what's going on with this patient, rather than communicating with multiple offices. So right there, that is the big advantage of a larger system that has one medical record. I guess let me brag on them a little bit first, because when you have multiple layers of specialists and you have a person that needs to see multiple specialists, that is really a good environment because the specialists don't even have to communicate with each other. I hope they do, but in truth, they just often pull up the most recent note from the cardiologist or the urologist or whateverologist and say, what did they say? And hopefully it's all in the note, but it loses a lot of personal touch. And for me, I still have to either ask for those records or communicate directly with the specialist. Like, I sent a lady yesterday to ear, nose, and throat for concerns about a potential mass in her throat. You bet I'm going to be calling that surgeon and saying, what did you really see? Rather than simply looking at the note. But that's more the difference between my concern for the individual patient and more of a personal touch than I might be able to get all the information I need just by simply looking at the note. And but that continuity of record, they don't have to ask, what did Dr. So and so say about Mrs. Jones? They can pull it right up. Where my system is separate from the St. Luke system, and we definitely share information when we have patient requests, but that is the advantage of the larger corporate medicine.
I was going to say, when you get a specialist on the phone and the two of you are talking, you can see, the notes, but this way it allows, I think, sometimes you can have a little bit of a conversation and maybe get into some more depth about all of this. And sometimes you come to a conclusion, too, that perhaps you may not have come to earlier.
Yeah, and for me, like I'll give an example. My brother is a radiologist in Colorado, and radiologists often are struggling to say, what exactly am I looking at? So they have to say, well, it could be this versus that versus another thing, but we lean more towards something, one of those three choices. So often that phone call for me is, okay, tell me what you see. Why did you favor that one choice over the other three? And then I get a lot more information about how they came to that conclusion, and it allows me to kind of get in the mind of that specialist. And so I do think the communication is an advantage when you have a direct verbal communication versus something that's simply the note on the paper. So that is a difference, and I know that the specialists, at St. Luke's are communicating one with another. If you have a general surgeon taking out somebody's appendix, they pretty quickly are calling back or communicating with their primary doc, who's internal medicine or family medicine. So I don't want to make it sound like they never talk to each other, but there is a tendency to say, hey, I don't need to communicate because it's already in the record. So if Dr. Bill wants to call me and talk to me, fine, but otherwise I'll just assume he got the message by looking at my note.
Sometimes those larger operations, too, they're very busy. And it's almost, I hate to say assembly line, but you bring people through so quickly sometimes. They don't have time to go beyond the notes.
Yeah, no, any medical office has that dilemma, especially if they're, liked by their patients. have had the experience of this summer, we're still building, and so it's a little different, but we're essentially an established practice, and for family medicine in general, there's usually about a 20% drop in patient volume during the summer. We haven't dropped a bit. If anything, we've increased, and we see a lot of new patients, which, bodes well for the practice, but puts some pressure on. Do you have a lot of time to talk? Do you have a lot of time to call somebody else, ask some questions? So I understand those pressures. But, in talking with a patient yesterday, I asked her the question, thinking about today's show, why did you choose to come to see us? And her response was, I work in agriculture, and I hate to say it, but the bigger system just feels like a cattle call, and I feel like you know who we are here.
We've got more with Dr. Jonathan Tripp coming up in just a couple of minutes. You might also want to reach the doctor in the next segment of the show. That telephone number is 736-0300, 736-0300. 71 right now, 20 minutes away from 9 o'clock on News Radio 1310 KLIX and newsradio1310.com. Joining us in the studio until 9 o'clock this morning, Dr. Jonathan Tripp from Tripp Family Medicine right here in Twin Falls, located on Fillmore Street across from the main post office. It's coming up on 844, 72. And Bill Colley with you as well on News Radio 1310 KLIX and newsradio1310.com. Doctor, first of all, easy to find your office geographically. That's not difficult because it's close to a lot of really busy roads in town. But for people who'd like to know a little bit more about your office, you have a Facebook presence and a web presence.
Definitely. On Facebook, it's Tripp Family Medicine. And on our website, it's trippfamilymedicine.com. And our telephone number is 208-933-4400. That's 208-933-4400. And, it's interesting because we participated in the Rotary Club's ice cream in the park and had a lot of fun there. In fact, we even won first place on the flavor name, which was Triple Bypass. And it had enough chocolate and candy in it that it fit the name,
Yes.
but at least we incorporated the word Tripp in there. It was a lot of fun. But,
well, you talk about your office, and of course, your community involvement is a sign of being local, which the fact that the CEO is right here in Twin Falls, I guess, is a good way to put that. You're no longer doing business where you accept chickens when you go to somebody's house on a call.
Well, actually, I would. So I don't want to push away those with chickens.
Right. It's about 100 years ago, that was fairly common, but there's still a lot of advantages to a smaller family practice that harken back a bit to those days when that was how it was.
Yeah, I had a great example. I have a grandfather who is, your general practitioner who people came from miles around to see. In fact, when they found out, he could work on their backs and necks because he's an osteopath. He lived in kind of the middle of Utah, but would have people come from down from, Pocatello and San Diego come up there, and in Phoenix, whenever they're traveling through, they would call and say, hey, can I get an appointment with Doc because they have a past history with him. But, he was really the guy who never, was not a doctor. Day and night, he was the guy all the time, and I honestly didn't want to be quite that much committed, but the truth is he's a great example of the individual patient was so important. And, people say, well, why did you do this? Why did you open a private practice? And it wasn't because I haven't worked with larger groups or had other practices that I've worked with. Had a great group that I worked with in Grants Pass, Oregon, large, mostly internal medicine, wonderful partners there. And the truth is by opening here on an individual basis rather than being part of the larger system, it really allows me to kind of say what we do with patients, how we spend our, shall we say, do our extra care, where we put extra time. Sometimes I've had a patient that, that day could not afford their visit, but they really needed to be seen. And I knew because I knew their circumstances, and it allows me to say, we're seeing them anyway, and we'll work out the financial part later. That wouldn't be true if I was an employed doctor. So it really allows me to practice medicine the way I see fit. And we still follow recommended guidelines by, AMA and multiple medical community recommendations. So it's not like we're practicing medicine that doesn't have evidence-based, theory behind it. So I don't want people to think, oh, well, he's practicing out there in left field. That's not true. It's just it allows me to be a little more humanistic when we decide what we're going to do with a patient, or spend a little more time.
When someone walks through the door in your office, though, it's entirely different than walking through the door, I think, of one of the really large medical groups.
Well, and you had that experience, and I think in one of our first shows you mentioned it's got a totally different feel. And that is our purpose. Our purpose is when you walk in the door, you say, are you sure I'm really in the medical office? Because it is very homey feeling. It is, I won't say luxurious, but it's a nicer than average office. It is not sterile feeling. We don't have all white walls and bad fluorescent lighting. I've worked in those environments,
Hmm.
and this is a better place environmentally. But most importantly is I have awesome front desk staff, awesome nurses. They know people's names better than I do. I'm really good at faces, but my staff are good at their names and who they are, and what their dog did, and when they've had to be somewhere else and where they went on vacation. And so when people come into our office, they really feel like they belong. They feel like they're known. They are not on that proverbial cattle call. And that's probably the biggest advantage, is really my staff is doing such a good job with them.
Sort
And
of like the medical version of Cheers. Everybody knows your name.
oh yeah, no, I haven't put that one into a slogan yet, but yeah, that it is really that feeling. We don't drink a whole lot while you're there, but
Yes.
it is that general feeling. And so I would love to have anybody that's got some experience with our office call in and let us know what you think. Am I blowing smoke, or is this really a different environment? Because to me, every day is a fun day to go to work because of that environment.
736-0300 if you'd like to reach the doctor. The telephone number 736-0300. We're coming up on 10 minutes away from 9 o'clock. It's 73. And you're listening to Better Health with Tripp Family Medicine on Top Story this morning with Bill Colley, News Radio 1310 KLIX, as well as newsradio1310.com. Yeah, one of the first days I was at the office, a fellow came in and he stopped, and he hadn't even gotten to the counter yet. And the folks at the counter were already joking with him. And I was listening to some of that conversation going back and forth. And it was as if two old friends had just encountered each other. And it was that sort of playful banter you get where people are maybe talking, what they say on the street, a little smack, but it's all meant in good fun.
Yeah, no. In fact, I asked my nursing staff yesterday. I said, well, what do you think the difference is? And there was a lot of statements like, well, it's warm, it's friendly, the feeling of belonging. But one of my nurses said, almost all the time when you come into our office, the nurses have smiles on their faces. That is not true of other places I've worked. And I'm not saying everything is just hunky-dory and perfect every day, but for the most part, we have an environment where laughing and joking is part of the norm.
I have a friend who works in one of those corporate environments and is counting the days until retirement, which that tells you maybe a little bit of the difference between a smaller family practice, and it's so impersonal even for a lot of the staff, not just the patients.
Yeah, no, in fact, um, I hope this is true, but I think my staff really don't fear me much like traditional nurses and doctors. My staff are pretty quick to tell me, Dr. Tripp, I think you should do this differently, or, you know, you really should say this a little different way. They'll let me know when I'm stepping on somebody's toes, or, not being as friendly as they think I should be. So that helps. I allow that balance to occur. And it doesn't hurt that my wife is actually our office manager, so they know she's the real boss and I'm just, one of the other grunts.
When it comes to doing this type of medicine too, as well, you and Russell have both stated that if you need an appointment, I know this experience. I remember a couple of years ago when I was still living out of state, I called the doctor's office and they said, well, we can see you. It was 2.5 weeks away. And if I couldn't make that appointment, it would be about a month
Yeah.
before I could get in. And, you feel you have some medical need right away, you want it treated.
Yeah.
Even it may not be deadly, but you want it treated as the patient. And in your case, people generally get into that office door quite quickly.
Yeah, we leave appointments open every day for what we call same day, or acute care. Now that's whether you cut your hand, or you have a bad sore throat, or something that's a sudden illness that needs immediate care. Nausea, vomiting, diarrhea. We can even do IVs in our office to help rehydrate you, where I don't know any other office that'll go to that extent. They pretty much say, here's a pill, and if that doesn't work, go to the ER. Um, so same day or next day is kind of our motto, but not if it is chronic care. If you're running out of your blood pressure medicine that you've never seen any other doctor for a year, we can figure out, get the prescription, but we probably won't get you in that day so we can talk about your blood pressure. So I want to be fair and say it's not everybody gets in the same day, but if you're hurt or sick, we try to get you in quick. Should I put a trademark on that one?
Yeah. When I was a kid and we'd go to the doctor's office, and for young people too, this is something I've noticed. We would go to the doctor's office, and of course, sometimes the wait would be, when you're a kid, it seems like it's hours.
Yeah,
It may not
forever.
have been that long, but the only thing they had to occupy your time in the office was either Highlights magazine or the Story Bible. And so I had the Story Bible memorized after my first couple of years of going to that doctor's office.
I'm going to have to get that one because I have Highlights, but I need the Story Bible there.
You have much more though, because you have TV, and the children can watch movies, so it's not like they're waiting for eternity here. They can keep themselves occupied, enjoy themselves before they actually see somebody in the office.
We actually set up our waiting room so we have an area that is geared towards the kids and geared towards the adults. So you've got, news and TV going on for the adults, and on the kids side you have, something along the lines of a Disney video that's running, as well as some games. And actually even the furniture is set up so that they're kind of padded blocks that the kids can stack and move around, and they have their own playground, so to speak, right in the waiting room, which was, part of our initial intention to invite children. That must have been a child going by right then.
Yes.
So
Speaking
yeah,
of quick,
what this brings up is because we're a smaller office, we can do things that create niches. If our patients want to know more about weight loss, we've actually had our PA Russell take on that as kind of what I call our spearhead for people that say, hey, what do I really do? I need somebody to really walk me through this. I've tried all these diets and they don't work. He's put together a very nice program package of exercises and diets that really are helping a lot of people lose weight. So that's one niche. Another is my practice for about 5 years in the Phoenix area was purely cosmetic. So we still do a lot of cosmetic things that we haven't advertised much. In fact, I have a little funny story, but this morning, because we're living in a fifth wheel while our house gets completed, and we ran out of regular soap, and I had my one of my cosmetic line products sitting there. It's actually a body wash of a pretty high concentrated glycolic acid, which I usually would tell a patient, never use this on your face, because it's meant for the body, the thicker skin. Well, I was out of soap and I used it on my face, and so I have kind of a red face this morning. If you can see the film of this show later, you'll see.
Exfoliate.
Yeah,
right?
I am well exfoliated this morning. In fact, my face is like it. Yeah, it's beautiful. So I mean, that cosmetic niche of even doing things like Botox and chemical peels and micro resurfacing, spider veins, all that's really the fun side of the practice. But we do a lot of dermatology. A lot of dermatology. I'm constantly telling people, hey, I am not a dermatologist, but it's a niche that we have carved out that I've done even since my residency. It's something I'm good at. Stitches is another, so urgent care. I've done a lot of ER work, so that's something I'm comfortable with. And we really push the women's health and the pediatrics. So, for me, these are areas that we've tried to emphasize, partly because I like them. When I have a kid in the office, that's my playtime.
When you mentioning pediatrics, because a lot of us who are between the ages of, let's say, 20 and 55 probably don't have as often medical issues. Obviously, some older folks do because of aging, but the children, and you mentioned this earlier, in the summertime, we're not getting as many colds because they're not confined, they're not in school, but children obviously manage to pick up a lot of things. And so they really need that personalized care that they might not get because you want them to get used to coming to the doctor and find out it's a happy experience.
Yeah, that it's not all negative. In fact, a typical experience will be a child will come in and be very shy in their first interaction with us, but by the time the office visit is over, I've showed them some secret hiding places, and or if they're a teenager, I've teased them about when they have a sore throat, who have they been kissing? There are all kinds of things that just make it a more lighthearted experience. And usually on a second visit, especially if this is a 5 or 6 year old, they're running laps around our office because they don't have any fear of what's going on there. They're not being threatened by the staff. They needles lurking behind every corner. So that's my intent. That it is that type of an atmosphere, and it just, I think, plays really well for. Without being disrespectful, it plays well that the family and the moms can feel like, I can bring my kids and not feel like I'm being judged because I have a child that's running around.
For people, again, who'd like to get in touch with the office, there's a tremendous web presence as well.
Yeah, our website is trippfamilymedicine.com, and I think we're getting these past shows put on there so you can find out other health topics we've gone over. And the Facebook page is Tripp Family Medicine, and our phone number is 933-4400, 933-4400. And if this sounds like the more personalized care you'd like to have, give us a call.
We'll see you again next week.
We will.
One
Absolutely,
of you. One of you. You or Russell.
Russell or both. And we're working on another guest.
All right, super. We thank the doctor for coming by today. Coming up, 9 o'clock news from Fox. Also, I believe we have a guest coming by from the Twin Falls City Council. It's 74 already. Bill Colley with you on Top Story on News Radio 1310 KLIX and NewsRadio1310.com.